Some health experts are concerned that Congress is about to create what could be a death panel for Medicare patients. The proposed bipartisan bill would restructure Medicare's payment system and grade doctors based on patient scores. Critics say the grading system, called MIPS, or Merit-Based Incentive Payment System, would cause doctors to avoid treating the sickest patients. And joining us now to explain further is healthcare policy analyst for the National Center for Public Policy Research, Dr. David Hochberg. Doctor, thank you for your time today.
Well, thanks for having me, and feel free to call me David.
All righty. Well, David, what are Republicans and Democrats trying to accomplish with this new bill?
Well, to give them a little bit of credit here, they're trying to repeal something in Medicare that has been a problem for quite some time, which is called the sustainable growth rate. But to do that, they're putting things in the bill that I think are going to harm the sickest patients on Medicare. In sort of an exchange for getting rid of the sustainable growth rate, they put in this thing, in this bill, the Merit-Based Incentive Payment System, like you said, MIPS. And basically what this bill does is it will grade doctors on a couple of things and give them either a bonus or a penalty on their Medicare fees, depending on how well they do. And two of the things they're going to be graded on is how well their patients score on quality measures, whether it be things like blood sugar level or blood pressure, and also how many resources the doctor uses to treat the patient. So basically doctors who are able to get their patients to score well on quality measures and use relatively few resources to do it will receive a bonus, while doctors who don't do that will receive a penalty. Well, if you just think about it a little bit, you can start to see the incentives this creates for doctors. If you try to treat primarily healthy, maybe moderately ill patients, well, those patients are going to have an easier time scoring well on quality measures. It's going to take much fewer resources to treat such patients, and so doctors who have those types of patients are going to probably get a bonus under MIPS. But if you have a lot of patients who are much sicker, that is the patients that really need to see the physicians, or most need to see the physicians, they're not going to do as well on the quality measures. It's going to take a lot more resources to treat them. Those physicians who take on a lot of those, heavy caseload with those patients, are more likely to be penalized. So basically you're creating a system here that encourages physicians under Medicare to avoid the sicker patients, and it will be the sicker patients who suffer because of this.
Dr. Hochberg, why now? What is it about this bill at this time that is getting bipartisan support?
Well, again, it's because of the sustainable growth rate, or the repeal of that in this bill. This is sort of the formula in Medicare that's supposed to cut Medicare physician fees each year whenever those fees grow too quickly. What Congress has done for basically the last dozen years is suspend the sustainable growth rate cuts. It suspended them 17 times. It's this perennial headache, and I don't think the SGR is particularly good for patients either, because doctors don't like this constant threat of large Medicare cuts, and as such, some doctors have limited the number of Medicare patients they'll take because of the threat of these cuts. I think getting rid of the sustainable growth rate is worthwhile. Basically, Congress now sees a good opportunity to do this. But unfortunately, they're getting rid of one thing that they should be getting rid of, but they're replacing it with something that I actually think is worse.
So how likely do you think it is that this will cause what you called a mini death panel?
Well, it's certainly the type of policy that you would see out of what's been dubbed the death panel by Sarah Palin, and I think somewhat accurately dubbed that by her. The Independent Payment Advisory Board, or IPAB, which is supposed to make cuts to Medicare whenever Medicare grows too quickly. One of the big worries, though, is that it would produce policies that would cut costs, and it would do so sort of on the backs of the sickest patients. And that's kind of exactly what you're seeing here with MIPS. So in that way, I think it's very much a death panel-like a policy.
Well, what can people do to protect themselves from this happening to them?
Well, the first thing to do is to try to get in touch with your senator and tell them to, before they pass this bill, take out the MIPS section of it. That's the first thing you can do. Beyond that, I'm not exactly, I'm a healthcare policy expert, not a medical expert, so telling you what to do in terms of finding the right doctor who will do their best to deal with this system, I mean, that's basically what I can advise you to do, is to, find a doctor you like and hope that he's going to do his best to deal with this system, whether you get sick or not.
Okay. Dr. David Hochberg, thanks so much for joining us.
Thank you.